Mei 13, 2018, good news kutoka Apollo Hospital India ni kwamba wamekuja Tanzania na mbinu mpya ya kutibu uvimbe katika kizazi, tezi dume, kansa ya ini na mgongo. Wamefanya huduma ya kliniki katika hospitali ya Hitech Sai. Kliniki hii inahusu mbinu mpya ya matibabu bila upasuaji. Dr. Sandip Jhala anaelezea namna ya kutibu magonjwa ya uvimbe kwenye kizazi, yani Fibroids, na mgongo kuuma au low back pain, kansa ya ini na tezi dume bila upasuaji.
Big number of Tanzanians have turned up being concerned for their health. And what I find is that a lot of them seem to have problems that are either diagnosed very late because of either not accessing the facility at the right time, or because of fear that keeps them away. And so what they require is good reassurance, and what I find from today's experience is that there is a lot to be done in the field of healthcare, and I have been concentrating on non-surgical treatments for mainly 4 areas. The first one, which is a very, very, very common problem here, is fibroids in women in the womb. And fibroids in the womb, if they are not diagnosed in time, they keep on growing, and once they grow to a large size, they don't allow them to conceive because it hinders the endometrial canal, and therefore they are not able to conceive. And if they do conceive, the baby is not able to grow, and they abort very frequently. So they have a typical history. They have very heavy periods, they have miscarriages, which are very common, and sometimes, or if they have a problem and they go to do an ultrasound, they find out that they have fibroids. But by the time what I see here, most women turn up, it's rather late. They should be examined when they have heavy periods. They must go and get their ultrasound done. Or if they have pain in the lower abdomen off and on, they must get an ultrasound done, and we come to know that they are fibroids. Now, the interesting thing that we need to understand is that for 100 years we had only one treatment, that we used to cut the fibroids, or remove them, or the womb had to be removed, which of course no lady would want to accept today. So today what we do without surgery is, because these fibroids have a huge amount of blood supply that goes into them, they keep on taking away most of the hormone from the uterus, and that is why they keep on growing. So what we do is, we make a very small needle puncture in the femoral artery in the groin, and from there we go right up to the fibroid, and then we inject into the fibroid small particles of alcohol, which are like salt particles, and these particles block the capillaries that are going that afford the circulation to the fibroid. As a result, what happens is that the fibroid starts shrinking and it becomes small. Now remember that conceiving has nothing to do with the size of the fibroid, but it definitely has something to do when the fibroid is pressing on the endometrial canal. So when these fibroids shrink and become smaller, the endometrial canal becomes free of pressure, and that is why they are able to conceive. So after such a treatment, the lady can walk about after 6 hours. There is no cut, there is no stitch. They can start doing their household work after the 3rd day, and their ability to conceive increases by 33 to 53% after this procedure. This magical procedure is called uterine fibroid embolization, which is something that I do. I've been doing for last 18 years now, and scores of women who previously thought they would never become mothers have become mothers, and is also something that commonly affects people. Is all elderly males above the age of 50 have a problem of enlarged prostate. The first symptom that they get is they have to get up in the night to pass urine many times. It is very disturbing. You don't get good sleep. During the daytime also they have this problem of frequency. Even more disturbing than that is something called urgency. When you are in a meeting, you can't resist going to pass urine. That's called urgency, and they have this kind of urgency as well. Now, all of these patients who have enlarged prostate, the only option available till today was to cut the prostate. Now, when you do that with a procedure called transurethral prostatic resection, or TURP, when you cut the prostate, the tubes that carry semen and urine, they come in contact. Therefore, they get what you call retrograde ejaculation. So the semen and the urine gets mixed, which is very messy. Plus, when they have infection on the raw area which has been cut, when they pass urine, they get a lot of burning. And they also have problem like sometimes when they have infection for a long time, the passage which is opened up actually closes, and it's called a stricture, which can be very bad. Now, these are the disadvantages of a surgery that we had to accept because we had no option. Today what we do is, again, we shrink that prostate with a transarterial embolization called prostate artery embolization. We just make a needle puncture in the femoral artery, go into the artery that supplies the prostate, and then we inject particles of alcohol, which are very, very fine. And what they do is they shrink the prostate as well as they change the consistency of the prostate and make it softer. Normally the prostate is hard, like the outer covering of a passion fruit. It's hard. But after this embolization, it becomes soft, and therefore the passage of urine is very easy. After this procedure, the patient starts walking about after 6 hours and can go home on the second day.
I would like to take this opportunity to welcome Apollo Group of Hospitals into Tanzania with the vision to improve the quality services which will benefit the population in large. Hitech Sai Medical Center was started in 2012 with the vision to improve and upgrade the health facilities in the country. And in continuation with the same vision, we invited Apollo Hospital staff, doctors, to have a medical camp at our center. And we are looking at having a long-term relationship with them, not only to upgrade the health grade facilities in the country, but at the same time, we would like to have some sort of exchange programs where the local population, the staff, the nurses, doctors could go on an exchange programs to India, have an exchange educational programs and training programs conducted between Apollo and Tanzanian population through Hitech Sai. We are basically trying to look at a long-term relationship with her, and we're trying to see how we can establish. The ultimate benefit is we want to bring good medical facilities into the country so that the system and the healthcare system in the country improves.
See, people should not become sick. People can minimize their disease burden, but that can be done only when you preventive checkups to be done once in a year or once in a 2 year. It is your body, and it is a priceless. You know, if research has been done in America, if you see that the price of your body from head to toe, it goes not in million, but in trillions and trillions dollars. So that is your body, that is how costly it is, you must take care of that. If you have a good cars, if you have good gadgets, you know when this going to be service renew or due, you are doing very particularly, but for your body you are taking as a granted. So this is the one preventive aspects, make it a habit once in a year or once in a 2 year, depending upon the age and the genders and the disease. This can be prevented. Of course, some age bound and some disease bonds will come, but it will not land you in a critical conditions. This is the one, we have a very standard preventive packages developed as per the disease, as per the genders, and as per the geography of across the globe. We are the pioneer who started, Apollo is the pioneer who started the Apollo preventive health checks in India as well. Second is that we have the curative, excellent program for the curative checks across the Apollo. We are doing liver transplant, kidney transplants, the stem cell transplants, all neurological works, cardiac works, then the complete emergency works. So the preventive, curative and emergency works are being done. Our purpose is that for developing this part, because every country gets the evolutions like that. India 20 years back was not today what the matured in healthcare. and one can easily see the healthcare before the Apollo and after the Apollo in India. To facilitate all the major part of the Tanzanian populations, Apollo resource is available on ground here. Mr. Alex, you can contact for any facilities or any informations or any facilitations. He is more than happy to help you all. Thank you very much.